have the right gauge for the type of IV therapy I'm going to use. So I'm going to perform an hygiene, and the type of needle I'm going to use is a 20 gauge, 1 1/4 length, and that's primarily used for blood transfusions, surgery, and special procedures. I'm going to go ahead and don my gloves. And now I'm going to prime my extension tubing. I'm going to draw 3 mLs from my vial. My vial's with an expiration date, so we're going to go ahead and do that. And I'm going to draw 3 mLs. And I'm going to attach my blunt cannula. And before we do that, I'm going to alcohol my vial, inject my air, and draw 3 ml. Now I'm going to prime my extension tubing. And that's primed, so we'll go ahead and clamp that. And now I'm going to select a vein based on 4 criteria. So I'm going to use the non-dominant arm. I'm going to use a site that's distal, and I'm going to avoid any sclerotic veins and anything that interferes with the client's ADLs. I'm also going to ask my client to extend their arm and squeeze gently. And I'm going to select a bouncy, soft vein. And I'm going to also avoid any arms that are affected with things like mastectomies and stroke, or patients that have shunts for renal dialysis. So now I'm going to apply my tourniquet 4 to 6 inches above the insertion site. So I've applied my tourniquet. So now what I'm going to do is I'm going to use my chlorhexidine, and I'm going to clean from inwards out. Now I'm going to get my needle, and I'm going to go in at a 15-degree angle, bevel up. I'm going to pull the skin taut in the opposite direction of where I'm sticking. So once I see flashback, I'm going to advance the catheter and remove the stylet, and I'm going to put pressure with my non-dominant hand. I'm going to put my needle in my sharps container. Now I'm going to attach my extension tubing to my hub, and my hub should be all the way at the skin. And once we do that, I'm going to remove my tourniquet. I'm going to apply my tegaderm and stabilize my catheter. And now I'm going to release my clamp. I'm going to aspirate for blood return, and I see a good blood return, so I'm going to go ahead and flush using the push stop method. I'm going to clamp that so we have positive pressure. And now I'm going to use my tape that I already prepared and stabilize my extension tubing. now I'm going to label my tegaderm with my initials, date, time, gauge, and the length. I'm going to assess for any signs of phlebitis, any redness or tenderness or swelling, or any infiltration, any paleness or leaking. I'm also going to document at this time. I'm going to document my attempts that I took to stick my patient, which was 1. I'm going to document the time and date of the insertion. I'm going to document the position of my IV, and I'm also going to document